My name is Dr. Stephen Linacre. I'm a clinical psychologist and I work at Lincolnshire Partnership NHS Trust. Dogs, I think. Dogs are my favourite pet. It's not just about not eating and it's not just about overeating. It's a way also to express emotions. We call it a coping strategy. Anybody can suffer from an eating disorder. There is no one kind of person that can suffer. It's something that is a condition that can affect anybody, just like any mental health problem. The first thing you need to do if you're a friend of somebody that has problems with eating is to listen to them. It's very important that people are not judged. There's services in Lincoln. There's the eating disorder service which I work for. You need to speak to your GP for a referral. But steps to change do help people with eating disorders, which you don't even need to go and see the GP. You could just self-refer online. What can cause disordered eating is a lot of things, and it's usually more than one thing. Unfortunately, some people do experience things like abuse or losses, and an eating disorder is an emotional disorder, mental illness, that is a way of coping. The common misconception is that it's a phase. It's just something that people choose to do. People are being manipulative, they're doing it to get attention. Common physical signs of disordered eating is people being obsessional about food. They could become more inflexible, so a person starts to not go out with friends because they're going out for dinner, or that they become very rigid in what they're eating. So emotionally there's a wide range, particularly those that are anorexic. It's more of a numbing sensation, so people can appear flat in their mood. Talk to somebody, not necessarily a counsellor, not necessarily the doctor, but to open up and say, I'm just struggling with this. First of all, I had to go on 2 weeks of bed rest. Once my weight had started to increase, I then went and started psychotherapy, and after 10 months I'd got to what we call my healthy BMI weight, but that didn't mean I was better, and in the end I then decided to go and do my A-levels, which was something that started to get me back into normal life and normal society. Very common, unfortunately, and I believe they're getting more common. That may be because people are saying I need more help, which would be a positive thing, but I do think media and society views shape and weight, I think, is also adding to people's problems with it. There's a lot of things that can be unhelpful. There's presuming that you just got to make them eat, or that they're just being awkward and being critical. Things like the person self-weighing. Talk to anybody to start with, but like I say, in terms of who you can seek for support, contact the Beat helpline. They can actually direct you to different services that are local. So a superpower would be for me to help people, first of all, recognise that they have mental health problems, and then secondly, encourage everybody, because a lot of people do suffer for years and years and years, but encourage everybody to take that big step. And if I could do that and wave a magic wand, that would be brilliant.